Thank you all so much for taking the time this evening to join this webinar. Each and every month, we are hosting these free webinars, hoping to educate anyone and everyone on cannabis and all the different aspects of the plant. Last month, we reviewed the differences between hemp, cannabis, CBD, and hopefully we cleared up some of the cloudiness around these terms. This evening, we're going to discuss the different ways we have to consume cannabis. There are so many different cannabis products out there, whether you go into a dispensary or a CBD store, the choices of the products are endless, and they can be very confusing even to an experienced cannabis consumer. One last note, or a couple last notes, is this webinar is being recorded and will then be posted on the Alchemy-Wellness website in a few days. If there are any questions throughout this webinar, please use the chat feature, and Morgan is our moderator and he will chime in, and I will have breaks every now and then. So if there are any questions, we can definitely get to them, or if you want to hold any questions or comments to the end, you are more than welcome to do that. All right, so let's get some introductions out of the way. This might be repetitive for some of you, but I still think it's important to have a frame of reference of who I am. So for those of you who do not know me, and that could be some of you and maybe not any of you, my name is Sam Shore, and I am the co-founder of Alchemy Wellness, which is a 501c3 nonprofit organization founded here in Albuquerque, New Mexico. My background, you see it on the screen now, is over 10 years in the pharmaceutical industry, calling on pain specialists, family practice, anesthesiologists, you name it, I pretty much called on them, from Durango, Colorado, all the way down to El Paso, Texas, and did that for just a little bit more than a decade. I got into the cannabis industry as a peer educator, also known as a bud tender for our Greenleaf Organics, and I did that for a little bit more than a year. Approximately 6 months into that job, as much as I loved it, got very frustrated with waiting for consumers and patients and caregivers to come to me. So I started with a group of other cannabis patients. I started Canna Health and Wellness, LLC, which was a company that was founded by medical cannabis patients for medical cannabis patients, recognizing the need that some patients needed outside of the dispensary in order to really help them have success with their cannabis use. I was also a consultant for the New Mexico Department of Health medical cannabis program, specifically provided them advisement on what packaging should look like as far as labeling is concerned on medical cannabis products. I take my cannabis medicine and career very seriously. I look back at my pharmaceutical career. Our cannabis labeling should look like pharmaceutical products in regards to ingredients, top cannabinoids, top terpenes. Do not operate heavy machinery until you know how this medicine affects you. Obviously, we don't need all the side effects that we see on pharmaceuticals, but we definitely do need to have similar type of labeling. I then became the general manager of Minerva Canna Group, their flagship location in Los Ranchos, before it moved to San Pedro and Gibson. I then moved on to become the director of education and community outreach for Pecos Valley Production. My role there was to educate and train their entire dispensary staff of well over 100 employees, as well as perform community outreach, very similar to what I did as a pharmaceutical rep, but doing it for the cannabis plant. I've done some consultant work for Mountaintop Extracts, and then that leads us to today as the co-founder, cannabis educator, and trainer of Alchemy Wellness. All right, so cannabis consumption methods. When many of us, if not all of us, started to consume cannabis, there truly was 1 to 2 different consumption methods. Inhalation, which was mostly smoking our cannabis, although vaporizing cannabis flower has been very popular for decades, especially in the medical community. Edibles, we would try and make them at home into brownies. Mostly they tasted horrible because we weren't actually extracting, we were just actually putting ground cannabis flower in there. But now, as you can see, there are many, many ways to get these compounds into and onto our bodies. How does someone choose which consumption method to use? Well, when you work with us here at AW, we teach you based on your goals, how, when, why to consume your medicine to achieve the best possible results. So basically in the next 30 minutes, we'll be reviewing these different consumption methods and some products which we can choose from. By the end of this webinar, we hope you will understand the pros and cons of these different products and consumption methods, as well as understand the benefit of using multiple products and consumption methods for optimal benefit. We call this layering our cannabis therapy. Okay, so inhalation. Inhalation is going to be the most popular way for us to consume cannabis, and more specifically, smoking, because we can inhale in other ways, which we'll talk about. So we're starting off by talking about smoking our cannabis medicine. So first of all, as we just talked about, inhalation, mostly smoking, is the way most cannabis consumers were introduced to the plant. It is also the method which allows the most immediate response to many medical issues, whether that is pain, anxiety, depression, even in some cases, more serious medical conditions like nausea and vomiting. It is also one of the less efficient ways for us to consume our medicine, and that is mostly because of the high temperature and the high heat. And we see the pros and the cons here. The most important con to focus on is going to be that smoke is carcinogenic. And there's absolutely carcinogens in cannabis smoke, not nearly what is in tobacco smoke and in cigarettes or other smokable forms of tobacco, but there's definitely carcinogens in cannabis smoke. And then here we are talking about vaporizing. And when we're talking about vaporizing in this section, we're specifically talking about vaporizing cannabis flower. Now, there's another way to vaporize, and we'll talk about that in a couple minutes. But here we're talking about using a vaporizer to vaporize cannabis flower. You see here the amount of medicine that is available, preserving about 95% of the cannabinoids, which means we get to take benefit of this lower temperature because we're vaporizing rather than combusting like we do with smoke. Both of these consumption methods are going to be instantaneous to 15 minutes with the duration of effects about 2 to 3 hours. So the fastest to start working and the fastest to leave our body.
I'm surprised that vaporizing cannabis hasn't been more widely adopted, given that statistic that they preserve 95% of cannabinoids, particularly for medical use. I guess it's just you have to break out the whole kit and get it preheated, and it's easier just to stuff a cone or whatever and go, I guess. But that's very interesting.
It's unfortunate that the majority of the devices used for vaporizing, like the one you see here, the Volcano device, they're ridiculously expensive, and most consumers cannot afford them. In the medical community, there are places where you can actually go and you can rent one, but the expense for people to own them is usually, and even, excuse me, even portable devices can be astronomical as far as their cost. And yeah, smoking, packing a cone, rolling a joint is a lot less expensive than a vaporizer, for sure.
Yeah, availability. Folks would rather spend that money on flour rather than, a $200 or $300 piece of equipment. I guess
luxury. It's a luxury item without a doubt, for sure. So when we're talking about inhalation, there is some very important chemistry or basic science that we need to understand. And if you've got a keyboard in front of you, feel free to throw this into the chat. But I would love to know what everybody on this call, and if you already know the answer, don't answer this question. How hot do we believe an average lighter is? Yes, there's different types of lighters. We're talking about an average Bic lighter. How hot does an average lighter burn? Super, super important when we're talking about smoking and vaporizing our cannabis medicine, because we're talking about 2,500 degrees is an average lighter. The longer you hold down the lighter, the hotter it gets. So 2,500 degrees. And then when we're talking about some important boiling points of cannabinoids and terpenes, you see on your screen here some of the most common cannabinoids and common terpenes, and the most popular one of all, THC, combust at 315 degrees. So once again, your lighter is 2,500 degrees. And this beautiful medicine, somebody just told me recently that they paid $14 a gram for their cannabis flower. And they put their 2,500 degree lighter to their THC that combusts at 315 degrees. So when we're looking at the differences between smoking and vaporizing, we see here as far as the difference of temperatures, which is certainly important, but bring your attention down to this final point. So when we're talking about smoking, only 12% of the cannabinoids survive that high temperature of that 2,500 degrees. Look at the other cannabinoids here. I mean, the highest one that we have here is what, CBN at 365 degrees, compared to this 95% is preserved while we're vaporizing. So many people, many consumers, when they switch from smoking to vaporizing, they recognize, just like Morgan was saying, a little goes a long way. I don't need as much medicine to be able to get to where I need to go. Another product which we can also be consumed through inhalation and vaporizing are cannabis concentrates. The best way for me to describe cannabis concentrates is to use fresh orange juice and concentrated orange juice as an analogy, compared to cannabis flower, like an orange juice from the tree, cannabis flower like we would smoke or vaporize, and cannabis-derived concentrates like we see on our screen here, like waxes, shatter, rosin, butter, or even cartridges. So just like in concentrated orange juice, the percentage of orange juice the percentage of vitamin C is considerably higher in the concentrated orange juice compared to the fresh orange off of the vine, just like cannabis concentrates you see on your screen here, considerably higher in THC and other cannabinoids and terpenes compared to the cannabis flower. Very similar to what we saw before, the onset's virtually instantaneous, the duration effects about 2 to 4 hours. And then we see the pros and the cons here. Due to the significantly higher percentages of THC, with some cartridges, we see THC percentages close to, if not over 90%. That is a super, super high concentration of THC compared to flower that's usually closer to the 20%. So when we're consuming such a high percentage of cannabinoids or THC, there's always the chance of drastically increasing one's tolerance levels, which can also increase the amount of money we spent. Concentrates like waxes, in my opinion, should be reserved for patients and consumers with severe chronic pain to potentially assist them with decreasing and or removing their prescription painkillers. And there are many different types of cannabis concentrates which can be vaporized. We see here in the glass container, this is probably something that people call diamonds or caviar. This product is meant to be inhaled through a vaporizing glass device called a dab rig, which is very similar to a water bong or water pipe, which one would smoke flower out of. And then on the other side of the screen, we have a cannabis cartridge. This product is also meant to be inhaled by using an electronic battery, which in most cases can be recharged and used with another cartridge if compatible with that particular battery. And during other trainings, we get into much, much more detail in regards to how do manufacturers make this gorgeous honey color, gold color medicine from flower. And we can certainly get into that in another webinar. Here we're looking at the timeline of how quickly inhalation begins to work. So as we talk about, it's virtually instantaneous to about that 15-minute mark, and then it plateaus. and then it starts to decrease around that. It depends on how much and depends on who, but somewhere around that 2 to 3 hour mark, we start to notice that it is out of our body. So this fast onset of action, how fast it starts to work, is one of the reasons why inhalation is such a great method to recommend for those needing fast effects from their cannabis medicine for their medical condition. However, on the other side of this fast onset is that inhalation is also the fastest to stop working, which is why when we inhale, we should layer our cannabis medicine and combine it with another consumption method like edibles, which we'll talk about in a second. So quick to start working, plateaus, and then quick to leave. If inhalation is smoking is the only method that we use, every 2-3 hours, we constantly need to smoke, and that is not reasonable. That is also not very cost effective. Edibles are such an interesting consumption method because there are so many variables which play a role in whether or not a patient will have success or feel any effect from cannabis edibles. THC needs fat to bind to our bodies. If a patient has low body fat, this may be a reason why they have poor success with edibles. I love educating people to try and adding some healthy omega-3 or omega-6 fatty acids with our cannabis edibles. Peanut butter, almond butter, avocado. Add that to your cannabis edibles and see if that helps increase the effectiveness of the THC. Most people report it does, in excess of 2.5 times more potent with the fat than without the fat. The other aspect that we need to think about is the gut a healthy environment? A lot of times when I'm talking to a consumer and they say edibles don't work for me, I ask them about any gut issues. They talk about how they have reflux disease or other GI issues, ulcers. Well, if the gut is not imbalanced, if it is not a hospitable place to put these delicate edibles in, we're not going to have as successful as an event. So try taking some Tums, try calming down that gut before eating our cannabis edibles. And for all that is cannabis holy, please be patient. Do not redose your cannabis edibles until at least 2+ hours after your first dose. If you do, I hope you went through my training, what to do if you're too high. And if you haven't, contact me offline and more than happy to educate you. So what does this last point mean, unpredictable dosages? Unpredictable dosages mean when a consumer tells me that I buy a 25 milligram gummy bear and all I need to do is bite the head off of the gummy bear. Besides being a little bit scary that we're just biting the head off of the gummy bear, we also have no idea how much, if any, cannabis medicine we are consuming. The 25 milligrams is for the entire gummy bear. Is there any way to determine how much is in the head versus the body versus the left foot or the right foot? Sure there is, if we take it to a cannabis testing laboratory. Different than what we see here as the chocolate bar, when we have these individual scored pieces, we can be guaranteed, we can be confident that each individual piece is going to be 25 milligrams. Now, I wouldn't cut an individual piece in smaller pieces because we just don't know, again, if that medicine is evenly distributed. I'll never forget, I was working in Hobbs, New Mexico, and a patient came in and asked me if their gummies were still okay to eat. He left them on the dashboard of his truck in the middle of the summer, and they all gelled together. And I said, sure they are. Good luck with the dosing. And he didn't quite understand what I meant until he started to think about it. And he explained to me that the other day he had a little piece and it didn't do anything. And then earlier today, he tried the same little piece, same size, and yes, it hit him very hard. So unless it is scored medicine, it is divided, we can't be confident of the dosing. Here we're looking at the representation of the onset of action and intensity of edible medicine. So as we see here, edibles begin to start working around that 45 minutes, maybe an hour and a half for full effect to really be somewhere between that 2.5 to 3 hour mark. And again, it's going to be different for all of us depending on healthy gut, not healthy gut, fat in our system, no fat in our system, food in our gut, no food in our gut. All of these will be variable, as well as how quick or slow is an individual metabolism. But if you remember back to the inhalation starts working around 15 minutes, and around the 2 hours is leaving our body. So if we eat an edible at the same time when that inhalation is leaving, that edible is starting to pick up, and we'll see another representation of this in a second. Any questions, comments at all, Morgan?
No, I don't see any questions in the chat. If anyone has any questions, there's a chat feature on Zoom and you can type them in there and we can interrupt Sam and get a conversation started.
More than happy to be interrupted. I don't love the sound of my voice that much, but let's keep on going with that being said. So let's now talk about oils/tinctures are some of the best ways to consume cannabis. But let's get some simple terminology out of the way. And this is always an area when there are dispensary owners, operators, or manufacturers in the room. I sometimes hurt people's feelings, but this is a fact. This isn't my opinion. A cannabis oil is a medicine which has an oil as the carrier. This most often is coconut oil or MCT oil. MCT oil stands for medium chain triglyceride oil, which is a derivative of coconut oil, sometimes hemp seed oil, sometimes glycerin, but it is an oil-based medicine. Now, a cannabis tincture, by definition, is a medicine which is dissolved and suspended in alcohol. Now, many, if not most, cannabis dispensaries and CBD stores use the term tincture, but they actually mean an oil-based medicine. So make sure you read the ingredients to know, are you buying an oil-based medicine, which is supposed to be put under the tongue, or are you buying a true tincture, which is an alcohol-based, which, please, unless you are a glutton for punishment, do not put it under your tongue because it burns. The alcohol is no fun. This type of medicine should be mixed in a beverage, added to food, but should not be consumed sublingually. So the pros and the cons we're looking at here, it's the simplest consumption method. We can truly use oils anywhere and everywhere. Maybe one day I'll be able to smoke in a movie theater, smoke cannabis in a movie theater, but until then, I'll use my cannabis oils in a movie theater if I need to. Some people do complain about the texture of an oil. If you ever are in a room when I'm providing a consultation or providing training talking about this, I will say to a lot of adults, you are not 5 or 6 years old. This doesn't have to taste like bubblegum or watermelon. Take your medicine and you will feel better. But I do understand that this can be a roadblock for some people, and that's why there are other ways for us to consume our cannabis medicine. So here we're looking at the 2 different ways cannabis oil not necessarily can be consumed, but can be absorbed. In this first orange section here, this medicine is absorbed quickly if we allow it to sit under our tongue and be absorbed in our oral mucosa. This green portion is going to be the small portion that doesn't get absorbed in our mouth, and we end up swallowing it down into our GI system. So I always like to tell people, if you want your medicines to start working faster, keep it in your mouth for as long as you possibly can. But there is always going to be a little bit of medicine that gets swallowed down and gets treated just like an edible, like we just spoke about. Cannabis-infused fat-soluble substances such as lotions, balms, topicals have become widely popular as a non-psychoactive alternative to consuming cannabis. By binding to our CB2 receptors found throughout our skin, cannabis topicals are able to provide local relief without entering the bloodstream. People have said to me before, I don't believe cannabis topicals work. because they do not enter the bloodstream. Well, we don't need it to enter the bloodstream because we have cannabinoid receptors on our skin. So cannabis-infused topicals are an amazing way to get quick local relief for chronic and acute type of local injuries and pain. For people not wanting to get cannabis into their bloodstream, or for people wanting to help increase the effectiveness of a current cannabis medicine, topicals help layer the effect. So I have a patient, a consumer that suffers from chronic pain, and they have local flare-ups in their hands or in their feet. Topicals are a great way to use for that local flare-ups. I always like educating people that the best time to apply a topical is going to be after a warm bath or shower. It allows our pores to open up and take on the medicine more effectively. In future webinars, we look at specific terpenes when added to topicals help increase the permeability and bioavailability of other compounds like cannabinoids. And we're not going to get into details in this particular webinar, but in addition to cannabis topicals, there are also companies making cannabis-infused transdermal patches, lotions, and creams. So in order to make these products transdermal, which means they enter the bloodstream, they must have a carrier to allow the medicine to penetrate and enter the bloodstream. If you look at the list of ingredients of these transdermal products compared to topical products, the list of ingredients are significantly longer and start to look more and more like pharmaceuticals. Transdermal products are useful for patients that are unable to tolerate inhalation, sublingual, or edible medicine, but are looking for a full body relief.
Hey, Sam, I got a question in the chat from Gary.
Please.
He says about how much gets ingested in the oral mucosa. I guess that was referring back to the oral consumption method.
Yeah, I'm assuming the question is in regards to a percentage, and I think that's going to, so that's really going to make a difference in regards to how long do we hold it in, as well as just like we talked about our gut health, what type of health is our oral mucosa? Are we a cannabis smoker and smoke kind of messes up our blood vessels in our mouth? Were we once a tobacco smoker for either long or short periods of time? And so have we somehow damaged? So it's a great question. And it goes back to things that we've talked about before. Our endocannabinoid system is so unique. How our bodies take on this medicine is so unique. Just like how healthy is our gut is going to take an effect on the edible medicine. The exact same thing is going to be for our sublingual medicine. How healthy is our oral mucosa, as well as how long do we hold it under our tongue? And I even tell people, swish it around your mouth. Get it all around as much as you can. Thank you. So cannabis suppositories are an amazing option for so many medical conditions. And they can truly be a game changer for many, many females. And the reason being is that the female reproductive system has the second highest concentration of cannabinoid receptors outside of the brain and the central nervous system. So let me pause on that, and I'm going to say that one more time. The female reproductive system has the second highest concentration of cannabinoid receptors outside of the brain and the central nervous system. Not our immune system is second. Nope, female reproductive is second. Not our GI system, female reproductive is second. So just think about that. For women that are suffering from painful menstrual cycles or endometriosis type of pain, or they're going through, just went through a hysterectomy and they have some pain. There are so many different reasons to use a vaginal suppository because of the concentration of these cannabinoid receptors in the female reproductive system. One of the pros that we see here on the screen is that it avoids the GI system. When we say a suppository avoids the GI system, this means since it's not going through the liver, it's being absorbed directly through the blood vessels in either the rectum or the vaginal wall. a consumer will experience something very, very different than what they might be used to with a cannabis edible. So let's think about this for a second. When we eat a cannabis edible, we are eating delta-9 THC, okay? Our liver then converts that delta-9 THC to a completely different molecule that we talk about in a different training and much more advanced training, but it's called 11-hydroxy THC, which is more potent than delta-9. However, when we use a suppository, it's just all delta-9 THC. So if a consumer is used to the feeling of an edible or used to the feeling of smoking cannabis, they should be forewarned, in not necessarily a positive or negative way, just in a different way. They should be forewarned. The feeling of suppositories are different. And I always like to make sure that when I stop talking about suppositories, which is in just 2 seconds, I always make sure that we talk about, hey, there is that risk of slipping out. So if you are going to use a suppository, either a rectal or a vaginal suppository, relax for about 15, 20 minutes. Lie on your side, lie on your back, on your stomach, relax for a little bit, and don't go for a 5-mile run after insertion. Otherwise, you're going to have really expensive underwear at that end of the run. And cannabis suppositories can be expensive. And I love teaching people how to make their own cannabis suppository. So reach out to me offline and more than happy to educate you on how to do that. So here we see the onset of action of cannabis suppositories. It's a slower onset of action, but a very, very long peak and long duration of action. This is a great method for somebody that the edibles just make them unfunctional, but they need a long duration of effect for their chronic pain. So what this bar graph is showing is the bioavailability of cannabis through the different routes of administration and consumption methods that we just talked about. Edibles are anything we swallow into our GI tract. When we eat cannabis medicine, our GI tract and liver break down the medicine, making it less of it available to our bodies. That's why you see it's the lowest bioavailability. But keep in mind, it's turning into 11-hydroxy THC, which is more potent. There might be less available, but that less available is more potent than the delta-9. And then here, the smoking and vaporizing inhalation, due to this method, avoiding the GI tract. Obviously, when we smoke something, our liver is not having a chance to process it. The amount of the medicine available is higher. But as we looked at, a lighter is 2,500 degrees, and our medicine vaporizes in the 300s or 200s. So we lose a significant amount of this. And then that final bar graph is going to be our suppositories, either rectal or vaginal insertion. Suppositories used when rectally or vaginally enter the bloodstream via the intestinal or vaginal wall, which avoids the GI system and being broken down by the liver. This method provides the highest amount of medicine available to our bodies to use. The effects are different compared to others. I always love when I'm training dispensary employees, I love to tell them, educate them, and tell them to push their consumers a little out of their comfort zone. You have people come in, ask for the highest THC percentage, go get a pack of suppositories, put it on the counter, and just see what happens. I guarantee you it will engage a conversation and confusion, no less. So we're going to wrap up this webinar with a quick review of all of these different ways to consume cannabis and how quickly they begin to work and how long or short they stay in our bodies. So we have here the smoking, the vaporizing, the inhalation in green, very quick onset, but it is out of our bodies. It's out of our bodies really by the time edibles are taking full effect, tinctures are taking a full effect, and well before suppositories. So if we are a cannabis consumer or we're educating cannabis consumers and we talk to them about, hey, if you need to fall asleep and stay asleep at night, smoking a joint before you go to bed is fantastic, but eat an edible at that same time, because when that smoke is leaving your body, that edible will be in full effect. So I would love the takeaway to be for us to use multiple consumption methods. Inhalation is great because it starts to work very quickly, but it also is the quickest to leave our bodies. So at the same time we inhale, eat our cannabis. All right, what did we just talk about? We talked about the common ways to consume cannabis: flower, concentrates, edibles. We talked about the combustible temperatures of these cannabinoids and terpenes compared to a lighter that's 2,500 degrees. Super, super hot. And then we went over the bioavailability of these common consumption methods. And really, we talked about layering our cannabis medicine and the benefits to use multiple consumption methods and multiple products at the same time. I always like to provide my resources. This was information that was certainly not created by me, but collected by me by doing research over the last years, and literally every day of my life, I researched cannabis, and more than happy to provide these resources and any other resources in an offline form. And then that's pretty much it. Thank you so much. I appreciate everybody joining. That was